As Medicare's annual enrollment period gets underway, millions of people with both Medicare and Medicaid may be missing out on valuable extra support. And joining us now to discuss how a dual special needs plan, or D-SNP, can help people get the care and resources they need is Marian Cabanillas from UnitedHealthcare. Good morning, Marian. How are you?
I'm great, Elliot. Thanks for having me this morning.
No, it's a pleasure. I think it's valuable, obviously valuable information for our viewers at home. So could you explain what a D-SNP plan is and who it's designed for?
Absolutely. So if you or a loved one has both Medicare and Medicaid, you could qualify for a dual special needs plan, which is also known as a D-SNP plan. And these D-SNP plans are for folks who may need more support because of income, because of a disability, or just because of their health needs. For many of the people who qualify, these plans could be available at no additional cost. Unfortunately, Elliot, here's the kicker. Nearly half of the people who qualify are not signed up. And that means that many people are leaving really important benefits on the table. So we want to make sure that folks know what's available to them.
Well, Marian, you've already taught me something, that the acronym is pronounced D-SNP. So who is eligible for a D-SNP plan, and why is now the perfect time for them to enroll in it?
You know, the Medicare annual enrollment period is actually open right now. So now is the time. And you actually have until December 7th to enroll. So folks that have both Medicare and Medicaid would actually be possibly qualified for one of these D-SNP plans. So we encourage folks to not wait and make sure that before December 7th that they sign up and that they educate themselves on what's available.
So here's a question for you as well. How can D-SNP plans simplify people's coverage and also help to lower healthcare costs?
That's a great question, Elliot, because these plans actually coordinate both the Medicare side of your benefits as well as the Medicaid side of your benefits. And what that does is that it makes it easier for you to make sure that you're using your coverage and taking full advantage of the benefits that you've got available. In addition to that, they can actually even help you lower your out-of-pocket costs. And most people that are eligible for these D-SNP plans actually manage at least one chronic condition. And that's why these are such great plans, because they actually coordinate your care for all of the services that you're eligible for. So some of that could look like tracking your doctor's appointments, supporting your medication needs, connecting you to support services for things like housing or even for caregiver support. And they can also help you to stay current with your preventive care. So for example, your annual wellness visits or your screenings. So as you can see, there's a lot of really important reasons why people should take full advantage of these plans.
Yeah, what additional benefits and everyday support can people access through these plans?
You know, Elliot, this is where these D-SNP plans can really make a huge difference. You can get not just your prescription drug coverage, but in addition to that, these D-SNP plans can offer things like additional benefits like vision, hearing, dental checkups, and even cleanings. But on top of that, you can get things like rides to and from your doctor's appointments, and they can even help you purchase over-the-counter drugs like painkillers. But on top of all of that, Elliot, many of these D-SNP plans can also offer additional benefits for people with qualifying chronic conditions. So imagine someone with diabetes, for example. They could be able to get things like help with their grocery bills for healthy groceries like produce. They can even get their utilities covered. So things like your water bill or your light bill could be paid for. I think it's really important, though, for folks to remember that benefits vary by plan. And so it's really important for folks to educate themselves and to check what is available for their specific needs and in their specific area.
Yeah, obviously that information is very important, but you know, are there experts that people can talk to? Because sometimes these plans can be a little confusing. Can they call someone at UnitedHealthcare to talk them through it?
They really can, and thank you for that, because you know we've got a website set up where folks can go and learn more about these D-SNP plans. Our website is getdual.com, and on that website you can find all sorts of information, not just about the D-SNP product, but also about how to sign up. So if any of your listeners have both Medicare and Medicaid, one of these plans could be a huge benefit for them. They can actually help you not just stay healthy, but also stay independent, which is what we all want. I also want to remind folks, though, that December 7th is that deadline. So it is really important that you take action soon so that you don't miss out on the opportunity.
Yeah, hopefully our viewers are circling that date on their calendar. Marian, thank you so much for all that information this morning. We really appreciate you.
It's my pleasure. Have a great day.
You too. For more details on the D-SNP plans and how they can help you get the support you need, visit getjoule.com or contact a local representative today.